Welcome to the Health Trip Podcast. My name is Jill Foose. I'm a functional medicine and integrative nutrition health coach. I created this podcast to bring you along as we travel down intriguing, science-packed roads, debunking old medical paradigms and perusing new innovative therapies and modalities with the finest functional medicine doctors, practitioners, and like-minded biohackers while living our best life. Enjoy the show. Hi, everyone. Welcome back to another episode on the Health Trip Podcast. Anyone who's ever had a massage understands the magic of what trained hands can do to your body, your mind, and the rest of your day. Bodywork techniques such as massages, rolfing, reiki, cupping, and acupuncture have been around for a very long time. And there is documented evidence that the first massage technique under the umbrella of Ayurveda was introduced back in 3000 BC. I've used many of the mentioned bodywork modalities for myself, my kids, and even my dogs. The definition of bodywork refers to the therapeutic effects or manipulation of the body for healing purposes. Makes sense. When I have a fitness-related injury, such as plantar fasciitis, I use cupping. When my entire body is sore from overuse in the gym, I go get a Thai massage. I've used acupuncture for stress-related issues, and so on. Today, we are going to focus on the lymphatic system and lymphatic drainage massages. The lymphatic system is the sewer system of our body, and we'd be dead without it. It's responsible for clearing out toxins, waste, bacteria, and water from our body that build up in our tissues. It travels alongside the circulatory system, branching out all over the body. Lymphatic massage has long been used for people who suffer from edema or acute swelling in the body, perhaps due to surgery, lymphedema, which is a chronic condition of the swelling of mostly limbs, as well as for other conditions we are going to talk about today. Lymphatic massages are also being sought after for their health and wellness benefits, such as detoxifying the body, debloating, increasing energy, giving skin a glow, and relaxation. My guest today is Dr. Christine Schaffner. She is a board-certified naturopathic doctor who has helped thousands of people recover from chronic or complex illnesses. Dr. Schaffner goes beyond the biological medicine, pulling from all systems of medicine and healing modalities, helping patients reclaim their wellness. Dr. Schaffner completed her undergraduate studies in pre-med and psychology at the University of Virginia in Charlottesville and went on to earn her doctorate at Bastyr University. With her diverse skill set, Dr. Schaffner seeks to improve access, outcomes, and speed of recovery for patients struggling with chronic, complex, and mystery illnesses. A quick little medical disclaimer before we dive in. By listening to this podcast, you agree not to use this podcast as medical advice or to make any lifestyle changes to treat any medical condition in yourself or others. Consult your physician for any medical issues that you may be having. This entire disclaimer also applies to any of my guests on my podcast. So sit back, open your mind, and let's dive in. Welcome, Dr. Christine Schaffner. I am so excited to have you here to talk about the lymphatic system.
Oh, well, thank you, Jill. I'm honored to be here, and I'm really looking forward to sharing what I know right now.
Yeah, in your intro that I did before we just met, I talk about how it's just not the sexiest thing out there to talk about. We don't come, a lot of the women listening into my podcast are in that midlife menopausal transition, and we
Yes.
don't really know about this lymphatic system and what it does and why it's important on our journey. And it is, it just doesn't get the hype that other body systems do.
Yeah, I love sharing about it because it's really overlooked and it's a very rewarding system to tune into and to have some strategies around because people feel so much better than when they start addressing it.
Yeah. Well, so before we dive in to that system, um, share a little bit about yourself. Why did you come to become a naturopathic doctor? What is a naturopathic doctor? What's all the magic behind that?
Yeah, absolutely, Jill. So I grew up in a family of medicine. My father's an oncologist. My mother is a nurse and a nurse educator. And so I was always around medicine. But, when I was in my teenage years, I was really always in the Barnes and Noble section of like science and spirituality. And I was just really open as a young woman as a looking at like the deeper questions of like why we're here, and looking at that interconnection to the greater forces and meaning of life. And so that kind of led me to kind of do that tightrope walk of like, should I become a medical doctor or should I look into these alternative realms? And so I found myself really exploring the realm of naturopathic medicine, and I made the decision to go down that road. And so, for those of you, if that's a new topic for you, or a new term that you're learning about, in holistic medicine, there's just various degrees and licensure that you can get. And a naturopathic doctor is a 4-year doctorate degree. There are a handful of universities in the country that train in this methodology. I went to the school in Seattle called Bastyr University. There's a great school in Portland. There's a branch in Bastyr in San Diego. There's a great school in Arizona. There's one actually in Connecticut and also in Illinois. And naturopathic doctors are trained. We have to do all of our pre-medical science. So I went to University of Virginia, did pre-med there. And we have to, again, do all those basic sciences. And then our first 2 years of education, we do cadaver lab, we study anatomy and physiology and biochemistry and all of those sciences that lay the foundation to understand a lot of, why people get sick. However, our treatment strategies are very different. So we look at the body as a self-healing organism, and that the body has this natural intelligence that it can self-regulate and heal. And our job as a doctor is to facilitate the removal of those obstacles that are in the way of the body's ability to self-regulate and heal. And those obstacles can turn into symptoms or labels as diseases. And then our treatment strategies can be anything from botanical medicine or homeopathy or nutritional supplements or diet or lifestyle. And then depending on the state that we're in, allows us to do different things. So on the West Coast and in Seattle, I'm recognized as like a real doctor, and I can prescribe
Mm.
medicine, and I can order labs, and I can order MRIs. I just can't work in a hospital, which is not my place to work in. That's not my skill set. Or I can't prescribe, stronger pain medication, but I can do really everything else. So it gives me a really big toolkit. So I have a really strong toolkit in the natural realm, and we can also do IV therapy and injection techniques. And then when we look at it, we call it the therapeutic order. So we'll start with these kind of natural things to start with, and then we'll go up the ladder of intervention based on how really the strength of the illness or strength of the pathology that the person needs. So for instance, what that looks like in my world, like sometimes I'll use antifungals. People have been living in mold and have mold colonization, and we do all this herbal therapy. However, they might need that fungus is really strong and they're really resistant, and we might need to use a stronger strategy. So naturopaths, we all practice a little differently. We all specialize a little differently. I think we're really the front line to recover people from chronic illness, and then to also share really root cause strategies for also preventing a chronic illness down the road.
Oh, it's such a great description. I have such a great visual of what you do now.
Yeah.
And I really love how you mention the ladder of intervention, right?
Mhm.
Because when you go to the hospital, they're at the top of the ladder out of the
Yes.
gate,
Yeah.
where you're trying much more subtle healing modalities to see if that's going to help this person, and then moving up from there as that person needs. So I love that.
Yeah, no, thank you. And I think it just gives us that dialogue and with the body, and the body's dynamic. So we can have that conversation with, of course, the person and the person's body. And then, again, we don't use the heaviest hammer first, because
Yeah.
we can overshoot the treatment if and cause other side effects if it's not the right thing at the right time.
Yeah, and I also love that you use both Eastern and Western, right? And you
Yes.
mix it, right? So if there is a need for medicine
Yes.
to help this person, you're not opposed to that.
Yeah, I use hormones, I use thyroid and adrenal support. I have somebody on my team who uses bioidentical hormone replacement. And, I'm really, life humbles, our ideals, right? And we just
Yeah.
really have to treat the person in front of us, right? And I am agnostic to whatever I need. I just, really tune in and individualize for that patient in front of me. And it looks like, many of my protocols is a combination, as you mentioned, of a lot of foundational, therapies and drainage and support, and then some of the stronger things depending on what people need at the time.
Yeah. All right, let's get into the lymphatic system. I didn't really know a whole lot about it. I actually went a couple months ago in preparation for this podcast and got a lymphatic massage.
Oh,
And I
good.
had no idea what to expect. I'm not going to really talk about it yet
Yep.
because I want you to talk about the lymphatic system
Yep.
first. But what is the lymphatic system? Why is it so important to our overall health and well-being?
Yeah, absolutely. And this is such an important topic, and I'm so glad that you're bringing the awareness to your audience about this topic. So, the lymphatic system, as we mentioned, very overlooked. We might have heard about it if somebody maybe is going through the cancer journey and they get lymph nodes removed, and then they have a lymphedema, and then all of a sudden they're doing strategies to drain their lymph. We often just hear about it when things have gotten pretty catastrophic or extreme.
Yeah.
However, this is an everyday system that is working very hard with or without your awareness, that helps to basically detoxify the body. And it's also a big part of our immune system. And when I see people who have chronic illnesses, there's often a combination of things that we need to do to look at the environmental toxicant exposure and to help eliminate those toxicants out of the body, plus the impact of that environmental stress on their immune system and how chronic infections can take hold. So think of like chronic Epstein-Barr, or people have Lyme disease or mold illness. And so that's the realm I work in. And so the lymphatic system is very meaningful because it's that intersection that we need to, treat both of these needs. And so how it works, I'll give a little lymphatic 101 if that's okay, Jill.
Absolutely.
Um, so we've all probably heard of the circulatory system, right? And so the lymphatic system is intimately interconnected with the circulatory system. So we have that oxygen-rich blood that leaves our heart and it goes through our arteries and it gets into these little smaller arteries called capillaries. And in this capillary space, this is where a lot of the action in the body is. This is a lot of like where oxygen is being exchanged and nutrients are getting delivered to tissues. And what happens in these capillaries is that a great majority of the blood leaves the capillaries and becomes what we call pre-lymph or interstitial fluid. And some of it returns back to the capillaries into the venous system and returns to the heart to get oxygenated. And in this, just kind of think about this visual right now. So we have a capillary, there's a bunch of fluid leaving. And what that fluid encounters is this, what we call space between the cells. We have cells, but we also have, well, we can talk about this and go in more depth, the fascia. So we'll have collagen matrix and we have this extracellular environment. And it's full of what we call proteoglycans. So you might have heard of chondroitin sulfate or keratin sulfate or hyaluronic acid. We have fibroblasts that are breaking the space down and building it up. And also we have mast cells that are a big part of our immune surveillance system. So it's a very busy space. And of course we have the cells in that tissue space. And the lymph is bringing nutrients to these cells and removing waste. And what happens is that our blood encounters a lot of our external environment. And what can happen in the lymph over time is these toxicants or pathogens that we get exposed to can start kind of building up in this space. And if this space isn't constantly draining and moving and getting taken up into the lymphatic capillaries, there can be what we call stagnation. So think about like the trash hasn't been taken out, or think about kind of like a dirty kind of fish tank that you got to change the water, right? So what happens if there's a buildup of this metabolic waste and toxicity, what happens is that the cells can't remove their garbage as well, right? And then what can happen then is the cells can break down in the communication between each other. So it's a like really important system to keep moving and draining, because if not, it can lead to really disease at the end of the day. So I'll turn back to that in a moment, but these lymphatic capillaries are intermeshed in these fluid spaces. So they drain the lymph. And so now you're in the lymphatic system. And so these lymphatic capillaries are part of a body-wide network that traverse throughout the body. And this lymphatic fluid can encounter lymphatic nodes, right? So you've maybe had a swollen lymph node at times when you've had a chronic viral infection or an acute viral infection or mono, or if you've been in a lot of pain or post-surgery. And these lymph nodes are kind of these little mini cities where they make B cell responses that make antibodies, or T cells that can say, hey, fight this bug. We see this bug, go fight it, right? So it's helping mount an appropriate immune response. And then this lymphatic fluid is making its way through this network of vessels and one-way valve systems. So the big thing that we'll talk about is why movement is so important for the lymphatic system, because that movement helps to move the fluid back into the circulatory system, where we have our thoracic duct and our right lymphatic duct, where it turns back into the circulatory system, into the blood, and that system goes over and over again. So that's kind of like a snapshot. And then Jill, I'll just kind of plant the seed. There's also lymphatic organs, right? So we have our thymus, we have our bone marrow, we have our tonsils, we have our spleen, we have our appendix, we have our mucosal surfaces that are connected to the lymph. Our gut has a whole lymphatic network. So it's a very big system, and our job is to keep that fluid moving so that our body can do what it knows best how to do.
So when someone has surgery and they have their spleen removed, does that affect the flow of the lymph?
Yeah, so if we have different organs or, glands or structures, that will definitely, affect the body. The spleen is a really important lymphatic organ, that it cleanses the blood and takes out red blood cells that might be infected by different viruses. So if you have your spleen removed, we have to, maybe stay on top of your immune system a little bit more, and we do some immune supportive strategies. I won't divert us too much, Jill, but I'd love to go back to this idea too of scars and scar tissue, because that's a big part of what can impede the lymphatic system. So I'm thinking, okay, a surgery and, of course, the sequelae of having the organ removed, but we also think about the scar tissue, and the lymphatic system is within the fascial network. And Jill, I'm happy to explain what that means. But the purpose of this moment here is to share that when we get injured, or we have a surgery, or we have a mole removed, our body is basically injured in the fascial network. And instead of creating that original fascial fabric, the body creates a plug, which is really wise and helpful, and thank goodness it does it. But that plug is a little bit denser and tissue. It's a little more sticky. It's a little bit more immobile, and it creates scar tissue. And scar tissue serves a purpose, but it can create what we call a traffic jam in this fascial lymphatic network. And that can be an impediment to really great lymphatic drainage.
Yeah, I'm very familiar with fascia because my boys are all athletes and they've
Oh,
had
cool.
probably 15 surgeries on their shoulders, their knees,
Oh,
their
wow.
hips. And so they always had cupping done
Yes.
to help with the fascia. Like I
Yes.
suppose what is that connection? Why is cupping connected to that, which is connected to the lymph system?
Yeah, yeah, absolutely. And so when we talk about the fascia, real quick, if this is a new term
Yep.
for people, it's this, in medical school, when we do cadaver lab, there's been a lot of misunderstanding, because when we observe a dead body, we see a very different system than a living body. And brilliant people like Dr. Jean-Claude Gumberto has been able to observe the living system, and it's a very different story. And fascia is not only structural, so it has a structural component where it helps to basically hold our muscles and our ligaments and our tissues together. However, it's also this continuum of connection and communication. So the fascia starts beneath the skin, and it actually has a through line of connection inside the cell to actually almost the nucleus of the cell. And it's a water transport system. It can transport water and hydration in the form of structured water to our cells. And within the fascial network, it's this continuum. The lymphatic system is there. And so the fascia actually helps the lymph move. So when our muscles are moving,
Mm,
the fascia can actually help the lymphatic system move through this network. And so, in the case of your boys, when they're really active and they have, again, injury and scar tissue, we need to help that joint heal, right? So we
yeah.
need to really bring blood flow and lymphatic drainage in and out of that joint space and the tissue around it so the body can bring oxygen, nutrients, and remove waste. And when, again, we have that scar tissue or something's been injured, that kind of flow of information and exchange can be compromised. And so cupping is a really, really cool kind of ancient technique in traditional Chinese medicine where they actually use these cupping structures that create kind of a vacuum in the tissue that bring blood flow and circulation to the kind of the surface. So it's a really great technique to remove stagnation and bring about healing.
Yeah. So if any of you are listening and you've ever seen people walking around with big polka dots on their back,
Yeah.
that's cupping.
Yeah. You
The
look
first
like a
time,
bruised. Yeah.
totally. The first
Yeah.
time I did cupping, many, many years ago, I didn't think that I was going on a vacation to Mexico the week after, and
Oh
that I was going to
gosh.
be in a bathing suit. And I
Yeah.
had polka dots the entire time all over my
Yeah.
back.
Yeah. I know. If people didn't know what cupping was, you were like, is that
Right.
okay? Yeah.
Right, right,
Yeah.
exactly. Yeah. I want to go back to what lymph is, right? When you talk about lymph, are you talking about the entire system or are you talking about the actual fluid and
Yeah.
what does that fluid contain?
Yeah, absolutely. So we have the lymphatic network, right? So we have
Mhm.
vessels, nodes, organs. So those are the structures for the transportation of the lymph fluid. So the lymphatic fluid, starts in the blood. So it's made up of minerals and nutrients and oxygen. And it actually can transport, for your audience, it can transport hormones and progesterone. So we rely on our blood to move a lot of information around our body, but the lymphatic fluid also can move different, really key components of the body, like hormones, throughout the body to get to the right places in exchange. And so we have the fluid that has its natural composite, but it shifts and changes depending on the environment in the body. So we have like normal kind of composition, then we have the composition of metabolic waste, so natural kind of cellular activity, and then we have the composition of life and modern life and kind of everything we've been exposed to, throughout the years that gets, kind of bioaccumulates and our body has to attend to it at different times. So I'm really intrigued and interested, and this is how I help people recover from a chronic illness, of looking at things like heavy metals or glyphosate or microplastics or mycotoxins. So that can actually get built up in the lymphatic fluid as well.
Yeah, talk about that. How do these environmental toxins end up in that system? Because it sounds like this system is really made of two parts. One is good, right?
Yeah.
It's moving around hormones, it's moving around minerals, information that our body needs, our tissues need. But then at the same time, it sounds like it's picking up garbage along the way.
Yes.
So
Yes.
how does it know how to drop off the good stuff and take the garbage all the way out?
Yeah, what happens too, and life gets overwhelming and we get more garbage than good stuff, or we can't keep up with the garbage, and so there's a couple mechanisms that I'm happy to share,
Yeah,
just to give
please.
people some ideas. So in life we can ingest. So if you have aluminum deodorant, so you're going to be applying it on the surface of your skin, that can get transported into the fascial network, into the interstitium, which I can share what that means, and into the lymphatic network. So that aluminum can not even get into the bloodstream and get through our, into our lymph through our skin. And aluminum has a really high positive charge. And that space between that I kind of shared, where all that activity, the collagen's there, the mast cells are there, a lot of health, which is hard to, it's kind of paradoxical, is a negative charge. So that space is like negatively charged. So by kind of electrostatic principles, kind of think of a magnet, right? Positive and a negative. The aluminum over time can just keep building on, building up and kind of being attracted to the collagen or the proteoglycans or the cell membranes. And that can, over time, if you're getting exposed every day, that can get harder and harder to get out of the body, right? And that's why we're relying on that just continual movement so it can do its best to get that free floating aluminum out of the body and so it doesn't stick around. So that's kind of one kind of visual I'd love to share with people. Another one that I know much of your audience probably knows about is glyphosate. Glyphosate has gotten a lot of recognition. Thank goodness I've been around. Dr. Stenov taught me in the early days about the impact of glyphosate. And glyphosate, the GLY, gly, is because it's a glycine analog. So it looks like glycine to the body. So
Mm.
we ingest it. We have a whole lymphatic network in our body, in our gut. When we ingest it, it can be taken up in the lymphatic fluid in our digestive tract. It also could just get digested and make its way finally to our bloodstream, and kind of again bathe, that space between we kind of want to look at. And over time, if we still, keep seeing glyphosate in that extracellular space, and let's say we are maybe not as replete or, we don't have enough free floating glycine to make our collagen matrix, glyphosate can start being incorporated into our own collagen. And so in the absence of glycine or in the presence of too much glyphosate, our body can build new collagen with glyphosate in it. And that can look like,
Mm.
basically be very stressful to our system because there's two thoughts, and I have seen this. So there's this idea like if you have a mixed connective tissue autoimmune illness, meaning like the body can't break down collagen and build up new collagen as well, or there's a lot of inflammation in your collagen. One of the thoughts has been, and I do think we'll continue to prove this in science, is that the body is not confused. Autoimmunity is not just a random thing. It's often there's an underlying cause that we just don't understand yet. And that the body could be in attempts to try to recognize or to clear out the glyphosate looks like it's creating all this inflammation. So those are, aluminum and glyphosate are like two really common toxicants we're all exposed to, and you have to really do your due diligence to not be exposed to them. So that's kind of one. Microplastics, I'm starting to educate myself more and more. These nanoplastics, get, into our blood, into our lymph, and can hang out in those spaces. If you've been exposed to mold, mold can get into or I should say, mycotoxins can actually get built up in these lymphatic spaces as well. And then, the list can go on, right? But those are kind of like, some of the, big buckets that I see as
Yeah.
far as just the toxicant piece.
Yeah. I want to go back to the glyphosate for a second. So the glycine, for those of you who don't know, is an amino acid,
Yes.
right? So we
Mhm.
need that for collagen production. But when you're saying that the glyphosate comes in and mimics glycine, it kind of tricks the body and
Mhm.
still gets into the collagen. And now the collagen and the glyphosate are building alongside each other, right?
Mhm.
How does that affect people in terms of hair loss issues, skin issues? Is there a
Mhm.
correlation there?
Yeah, I think there's many ways that this is kind of a really multi-systemic issue. Glyphosate has many mechanisms in the body, and that's why it's really, some graphs kind of see the rise in chronic illness with the increase in glyphosate use in the 1990s when Roundup Ready crops
Hmm.
were brought to market. And so Dr. Seneff and Nancy Swan have kind of looked at these chronic illnesses curves and see them kind of almost in parallel with the use of glyphosate. And glyphosate can impact our connective tissue. It can also impact our liver, our microbiome. It's an antibiotic, all of these things. So there's probably many reasons, Jill, that glyphosate is at the root of those. For kind of just tuning into the collagen part. So what I see, without going down a whole other rabbit hole. So I mentioned already that I see the collagen matrix. It's part of the fascia. It's the most abundant protein in the human body. It's part of this whole body communication network. And I've read papers and I observe in my practice that we think a lot about the autonomic nervous system and
Mm-hmm.
communication, which is huge. It's a huge part of health and healing, don't get me wrong. But
Yep.
there are some people thinking that the fascial network is actually a faster communication network than the autonomic nervous system. Again, this is a new thought. Probably a lot more science needs to happen. But from observation, I'm like, maybe in my lifetime we'll get there. And so when we have like an interruption in our collagen, so like, okay, that's not quite right. It's foreign, it's man-made, it's not, life, it's not what we're part of. There can be an interruption and an impedance. So there can be basically our body can have a breakdown in communication in different systems, and that can also
Mm-hmm.
affect us as a whole system. It also can weaken, right, our collagen. So people who have a lot of connective tissue issues, which you mentioned hair is an outcome of that. Our skin, our nails, there could be definitely a weakening of our the tissues we see kind of on the outside because of
Hmm.
a collagen. You can, or sorry, glyphosate. You can measure your glyphosate levels. So if this is something you're like, is this happening to me? Is this a problem that I need to think about? You can get a urine test. There's a couple labs that do this. Great Plains kind of started it, where you collect
Mm-hmm.
your urine and you can see, do you have a little bit of glyphosate in your body or a lot of glyphosate in your body? And glyphosate doesn't belong in the human body. So if you have like really any, that could be an issue. There's lots of techniques and brilliant minds of people trying to figure out how to get it out of the body. Again, we want to avoid exposure as much as possible, but even if you're eating all organic, you can have exposures in, the water and the rain, like there's just a lot of ways that this is getting more and more impacted in our environment. So some of the main ones are using fulvic or humic acid that can bind and kind of debulk your body of glyphosate with your exposures. If you're going out to eat at a restaurant, you can take some fulvic or humic acid, before you have a meal, and that could maybe mitigate that exposure. But it's, a lot of brilliant people are trying to figure out how do we recover our soil from the glyphosate exposure that we've seen in the last 20-25 years.
Mm-hmm.
And, we're also trying to debulk it in the human body as well.
Yeah. Wow. Very, very interesting. Oh my God, I have a piece of paper next to me with notes and I have scribbled all over it, all of these, all of these words and thoughts. And
Yeah.
it's just incredible. I wanted to go back to the deodorant. So this is a
Yeah.
big one, right?
Yeah.
Everybody wants to use
Yeah.
a product that works, right? I sweat a lot, not just because I'm menopausal. I'm a big sweater. I have one of my 5 kids. He's a big sweater. Some people are just genetically predisposed to that, but I
Yes.
have switched. I have walked away from the aluminum containing and I just wear clothing that keeps me cooler. I wear a lot of tank tops, right? So I have a lot of lifestyle strategies to help me with that. I also don't drink alcohol and
Yeah.
I do certain things. But what are people supposed to do if they are like me and my son and they are heavy sweaters?
Yeah, it's such a great question, Jill. And, we live life, right? We have these kind of inconvenient truths, and then we have our, we have our life that we have
Yeah.
to live. And, just to take a step back with naturopathic medicine, I just want to bring one thing to our attention. So, I agree that there's a lot of genetic propensity, but there's often kind of epigenetic triggers, right? And
Yeah.
so if you're finding yourself that you're sweating a lot, or even you can't sweat. That can even be a problem, right?
Yeah. Yeah.
But let's talk about if you're excessively sweating, there could be, like, in our way of looking at the organs of elimination and how the body eliminates. We've talked a lot about the lymphatic system, but the skin is a huge organ of excretion. And the skin can actually be supporting us and trying to help us to excrete waste or toxicity if other organs of elimination are a little bit plugged up. So I would take a really good history of your liver and your kidneys and your colon and your gallbladder and your lungs, and can we support you a little bit more there for a maybe a different effect. So I just wanted to plant the seed. So again, this is, all of us are on the planet right now, and we're only as healthy as we eliminate, and we have to just really look at these toxins in modern life and how they're impacting us. Aside from that, the natural deodorants are getting better. I've been on
Yeah.
those for a while, and they definitely were not good in the beginning. I'll
No.
tell you that. So I found a few that work for me. However, again, the strategies that you shared, and then you have to reapply these. These are not going to be
Yeah.
the all day 24-hour.
Absolutely.
I bring my deodorant in my purse, in my backpack, and I'll probably apply my deodorant once or twice a day, especially on the conditions. And that's kind of the price we have to pay to not get aluminum in our tissues, right?
Yeah.
Um, Also, there are, the difference between, if, like, okay, let's say you're like looking at a natural versus, like, okay, what's an antiperspirant versus a deodorant. And so we just really want to stay away from those antiperspirants, because those are going to block our ability to sweat. And so that can have an effect on us over time if we use that, because that can stress out our body's route of elimination. And then, of course, that a lot of the antiperspirants have the aluminum in there.
Yeah.
And then the deodorants can just help mitigate those, strategies. So those are kind of some of the things I want to say, and it's just coming to me. So I'll just share this real quick, Jill. A tip: if you've had a lot, I've seen some people regulate their ability to sweat, and then also help detoxify if they've been a heavy aluminum deodorant user in their life. There are different herbal products that I use that are kind of like healthy deodorants that you wear at night, and they're herbal preparations that you can put in your armpit or around your lymphatics to help pull out and detoxify through your skin those aluminum depots and residues that are in the body, and they work quite well. But we know, as women, our breasts are lymphatic tissue, our armpits are right there at the
Yeah.
basically the drainage spot for the breasts, and the apical lymph nodes and the sternal lymph nodes and the thoracic and right lymphatic duct. It's a really overlooked part of breast health, having healthy deodorant use.
Oh, I love that. So, what are some of these products? And you only use them at night, so they work at night?
Yeah, yeah. So I have been using two things for a long time. One is called BioPure Deo, or there's another company called Herbalix. They use kind of similar formulas, and they are these nighttime deodorants where you put
Mm.
them in your armpit, and they were using that excretion properties through the skin to get rid of, a lot of the buildup of what's taxing our lymphatic system, and these toxicants that get lodged in the tissues. And I'm a big, believer of we have to use lymphatic drainage strategies on every day, like every day we have to do something, right? Um,
Right.
so this is just kind of one focal area of the lymphatic system. But another, cool thing too on this topic is I love castor oil. Castor oil is kind of a old-timey kind of
Yeah.
naturopathic treatment that's gotten a lot more popular. It's using the oil from castor seed, and it has these properties that have been studied that bring lymphatic drainage and circulation to a tissue. So we use it a lot over the liver. You can put it on your breasts at night too. You just kind of want to wear a t-shirt that you don't care about because it's a little sticky. It will absorb overnight, but in the moment where you're falling asleep and putting it on, you want to do that. So those are good, strategies. I created a lymphatic drainage cream myself, just to kind of fill a gap, and that has a few cool properties to help move the lymph. And then also if you've had like a chronic viral infection or chronic immune thing that's been keeping your lymph nodes kind of inflamed, that can be really helpful. But we want to move, we want to sweat. There's all sorts of cool tools out there, from vibration plates to gua sha therapy. There's gua shas for our face and our body. There's vibration tools for our body. Like a low vibration can just kind of get that fluid moving. Also drinking really clean water, and I'm a big proponent of structured water. Structured water is a really unique form of water. For just this moment, I'll just share it helps move the fluids in our body. It does many other things too. So yeah, you just want to find what works for you and just do it most days, and if you can do that, a lot of these things that I've been sharing about, you won't get into trouble with. So
And what does it look like if you are in trouble with your lymphatic system?
yeah.
Now people are going to know from listening to you what it is, what it does, but how do we know that we have an issue with it?
Yeah, it's really, many symptoms. So from brain fog, insomnia,
Mm,
anxiety, depression, we have a whole lymphatic network in our brain that I haven't even touched on. There's so many things to talk about, right?
right.
From sinus congestion to sore throats to allergies to pain, inflammation, cellulite, any bloating, constipation, abdominal pain, any itchy skin or acne or any rashes or psoriasis or eczema. So it's really quite multifactorial, the systems that can show up as lymphatic congestion.
I mean, that sounds like so many things, right? It sounds
Yeah.
like menopause. It sounds just like aging. It sounds like just being sick, right? It sounds like just sports related injuries.
Yes.
So, how can we help women
Yeah.
and men, right? We're not going to
Yeah.
leave the men out, but how can we
Yeah.
help people really dial into, oh, this is my lymphatic system and I really need to take care of it?
Yeah. Yeah. So great. So many things I can share, and I don't want to overwhelm your audience, but I'll just, go through it, with you. So, one thing I haven't shared, Jill, that I think is important for that, answering that question is that we have a whole lymphatic network in our
Yeah.
brain. It's called the lymphatic system, and it's called lymphatic because it's based on this cell called the astrocyte, which is a glial cell. And astrocytes look like these star-like shaped cells that regulate the flow of fluid and lymph in our brain. And they, again, bring the nutrients and oxygen. When we sleep, our brain shrinks 60% in size, and this fluid comes along our arteries, bathes our neurons, removes waste, and gets out of our brain through a couple key pathways that I'll share along our venous system. And the health of the lymphatic system is dependent on our sleep and our ability to get deep and REM sleep. Really important. And also, if you've had a traumatic brain injury, or a head injury or concussion, this can get damaged. And that's why we
Mhm.
see NFL players get, more cognitive decline. It can be totally fixed. You just have to know what you're dealing with.
Right.
So the lymph gets drained out of our brain through the cervical lymph nodes. So we want to make sure that highway is, open and draining at night so that fluid can leave. It's a body-wide system that's highly interconnected. So one area of stagnation can affect the whole body.
Mm,
That's why we want to, support the neck, cervical lymph nodes. And then we did kind of like a cross section of our head, we have, through our nasal passages, it's called the cribriform plate. Lymph drains kind of through there, and it kind of then exits through, like kind of through our throat and our tonsils. So having, really healthy sinuses and doing sinus irrigation and not letting sinus infections, or if you've had mold exposures or chronic allergies, that you have just some technique to kind of bathe and drain your sinuses every day, that can really help the lymphatic system in your brain. And then the tonsils are a really big area. That's an area of focus when I'm healing somebody from a chronic infection. But we want to make sure that that tissue is healthy and draining and not kind of being a plug in the, drainage in the brain, and it's the top of the gut too. So if you have chronic gut issues, the tonsils could be at play. So I have a lot of my patients use like Propolis throat spray and do different sinus sprays. So that's kind of looking at the head. So that's lifestyle. Are you sleeping well?
Right.
That's huge, and I could talk to you all day long about sleep if you'd
Yep.
like. And then are you kind of draining in your head? And then when we think about the gut, so the body's really interesting. I mentioned like the thoracic duct is on the left side, of your left arm, it's right around your clavicle. It drains most of the body. The right side, it's the right side of our head and our right breast and our right arm. So if you're having symptoms on, certain areas, you can kind of look around, and it drains into the right lymphatic duct. That all goes back to the circulatory system. And then another hot spot is called the cisterna chyli. It's kind of right in the between the belly button and the diaphragm. And that drains the whole leg, all of our legs, our abdomen, our gut, and that brings lymphatic fluid back into our thoracic duct. So breathing, a deep breathing can expand and contract our rib cage. That can bring those fluids up and move them and keep them circulating. So that's really important. And then if you have a lot of digestive issues, I'm not sure, Jill, if you got that, with that lymphatic drainage massage, if they did your abdomen, they don't
Yeah.
always, but the abdomen is a really great place to focus, because if the lymph is stagnant and pooling in the abdomen, it can affect the drainage in the whole body, and especially the lower extremities. So if you have digestive issues that just seem to be like not moving, this could be an overlooked area, because we have lymph within our gut, but we have it around our gut and the mesenteric lymph nodes and things. So keeping that moving, the castor oil,
Yep.
just lather it all over your body. And then we have in the bikini line area. So if you've had a lot of pelvic floor issues. So if you've had a lifetime of like ovarian cysts or fibroids or endometriosis, or you had a C-section scar, all of that is really vital to, treat, to, keep everything moving and draining in the pelvic floor. And with menopause, we just, want to make sure we have healthy hormone levels to keep everything just in the right place, right? So if our hormones tend to decline, which they do, with age, estrogen levels could be important, and testosterone can help with just like the muscles and the fascia for the whole pelvic floor. And then the lymph in the legs, we think about behind the knees are a really key area, and then around the ankles. So like that gives you kind of like, some of the hot spots. There's a really
Mm-hmm.
popular influencer now. I can't remember his name, but he's cool. I think he trademarked it. He calls it like the big six or something, but he finds these, key areas like that we just have to pay attention to. And the more we pay attention to every day, the more we're just confident that our system is moving and draining.
Yeah.
Yeah.
So the moral of the story is that everything is connected, and the lymphatic
Yes.
system is a really important player in this equation for overall
Yeah.
health and wellness.
Yeah, no, absolutely. It's just, and try it, you'll be pleasantly surprised. Most people, if you have headaches, allergies, stomach issues, like, do some things for your lymph and see how you feel. I'll share one caveat, Jill, just for those who might be on more kind of the, sick side, just dealing with a lot of stuff. Um,
Mm-hmm.
if you start moving your lymph and you're like, oh my gosh, I feel like I have the flu, I have a sore throat, um, that is a sign that your lymphatic system really needs this. So
Mm.
just slow down a little bit, but keep going forward. Maybe take some vitamin D or do some immune support, take some binders, whatever it is. But you'll get over that hump for sure. But that's just a symptom that not to hold back, but to like keep going forward, because your body's just has a lot of stagnation in that area that you're waking up. That's not very common, but it happens enough that I don't want anyone to get
Yeah.
discouraged who's talking about it, and who's thinking about this or goes through that. So I feel, but yeah, again, try for yourself. You'll be really pleasantly surprised, and I think, yeah, I think it's a really awesome addition to anything that you're doing to support your transition into menopause, and you'll feel a lot better.
Yeah, let's just for the last few minutes, I want to focus on that midlife menopausal woman. Um, the transition is already hard enough. Some women
Yes,
are just starting their journey, just in terms of educating themselves on the current science and data that's out there. It's very confusing on social
yes,
media. There's a lot of influencers, a lot of doctors. People are saying, do this, do that, don't do this.
yeah,
So people have a family history of breast cancer or ovarian cancer, and they just don't have all the facts and all the data, and they don't know all their options. So we have women who are on board, like myself, like yourself, right? And then we have people who are just a little bit further back on the road, starting out this journey.
yeah,
And what are some realistic strategies that they can start inputting into their world today, right?
yeah.
That are going to help them. So you mentioned movement. So I'm thinking you're talking about daily exercise.
Yes. Yeah, daily exercise and walking. And yeah, and just to that point, Jill, it's really confusing out there and everybody has to do what's right for them. But
Yep.
there is a lot of misinformation about hormones. So find a provider who's going to tell you the truth and individualized for you. Because
Yep.
having low hormones can put you at risk for cognitive decline, cardiovascular events, and osteoporosis. And so it's a really important, piece of the puzzle. And I didn't mention this, so just real quick, when we think about giving you hormones, the hormones have to go to the cell membrane and sit in a receptor, and then that turns on the cell and you have the effect. So if that lymphatic fluid is all congested and you don't like feel like you're getting a good response from the hormones yet, treat your lymph and you could actually get better
Mm.
results with your hormones after that. So I just wanted to
Yeah,
share
that
that.
makes so much sense.
Yeah, so yeah, that's a lot of I think it's people think, oh, they're not working for me. And it's like, no, you need them, but you just haven't cleared your lymph and you haven't cleared your terrain to accept and receive them yet. So, movement, hydration is really important, good, clean, filtered water that has minerals, that's really important. Castor oil is cheap. You can go get that, do that every night. Make sure that you're sleeping. So I'm a big fan of melatonin. That we live in a life, that's melatonin deficient. So that helps us to get to sleep. GABA can be very helpful too. Obviously, if you're low in progesterone, that can affect your sleep quality as well. So get moving, hydrated, get sleeping. If you have scars on your body, work with an acupuncturist or somebody who knows how to do massage on them. Or I do a technique called neural therapy. It's a little harder to find, but it's an injection technique that really breaks down the scar tissue and gets the
Mm.
energy moving in that tissue. It can be very quite life changing to do that. And so just find again what works for you, but don't ignore your scars. And then treat your sinuses, your tonsils, get a good biological dentist on the team. That is a huge component of
Yeah.
if you have a source of
Yep.
toxicity in your mouth that can chronically poison your lymph, and that affects your breast health, so that
Yep.
is really important. If you have any fibroadenomas or breast concerns, look upstream to the mouth. So, and then, I've created some products and I love using topicals. We have topical GABA and lymphatic drainage creams, and I work with plant stem cells that are from Italy, and they're really great, beautiful drainage allies. So, there's a lot more information now than ever before. So, if you start Googling lymphatic drainage, you're going to find more than you have in the past. And just make it part of your life and your lifestyle. It's not just you do a lymph cleanse and then you're done. It's really a way of life.
Yeah, I really love that you bring that up, right? Everything that we're trying to discover now that works for us, this is our lifestyle. We are in the final third of our lives.
Yeah.
The final
Yeah.
third. And, as a health coach, I work on lifestyle interventions, and we start with what is that greater health vision for yourself? And how do we connect all the routines, and it's always going to be hard at first, right? Anytime you're going to do anything different out of the ordinary, off, schedule, it's always going to be so much more challenging and hard. But eventually it becomes just your new normal.
Yes, yes, yeah. Just give it a week and then it becomes like, okay, you
Right.
got over the hump, and then it becomes more of a routine the more you are consistent. And if you fall off the wagon, just get back on. The body is very forgiving. It regenerates. It, continues to support us whether we take care of it or not, and, just keep on doing your best each day.
Wow, Christine, thank you so much. What an amazing episode. I am absolutely going to have you back because I
Oh.
didn't get through 2 of my pages of my comprehensive outline that I wrote for you.
Well, no, thank you so much for having me, and I'd be very happy to come back and continue this conversation and take it another level
Yeah,
deeper.
thank you.
So,
So
yeah.
I'm going to list all of your website, your social media handles, so everybody knows where to find you in the show notes. But is there anything about your website or on your website that any free resources that people should know about to dig for?
Yeah, no, thank you. So I do a lot of education about the lymphatic system. So just you can catch me on my podcast or on Instagram, or on other summits or wherever I'm talking. And again, we created a line of products to support the lymphatic system. So if you need some solutions, Jill, has those resources as well. And yeah, just keep educating yourself and keep showing up for yourself. And I promise you will not regret it.
Oh, well, thank you so much again. I know everyone's walking away with a bag full of golden nuggets from this conversation.
Thank you. Thank you, Jill.
Thanks everyone for tuning in. Thank you for joining me. I hope you enjoyed the podcast. Lifestyle changes can be hard and overwhelming to make. By building your support team of functional medicine doctors, therapists, and health coaches, you can reach your optimal health goals. Be sure to check out my other podcasts. Until we meet again, stay healthy.